Let's say it together. An idle uterus is a fibroids workshop. Hello YouTube, welcome to my channel. In this video I am joined by friend and fellow doctor Namunji Matale. So we will be talking to you guys about fibroids. All that you need to know about fibroids, like what are they, how do they come about, who is at risk, what treatment options are available, and we will also be debunking popular myths that we've come across in our practice. So I really hope that you enjoy this video. And this comes as a third installment in my July Fibroid Awareness Month series. So if you're new to the channel, you can check the old videos out. I will post the links in the description box. But yeah, I hope you enjoyed this one. Stay tuned. So welcome to the channel, Dr. Namunji.
Thank you so much for having me. I'm super excited.
Yeah. Tell us, where are you currently stationed, and what exactly are you doing now in your career?
Okay, so like you rightfully said, I'm a medical doctor. I'm not a specialist just yet. I'm a junior resident. I'm stationed at UTH. That's our biggest referral center in Lusaka, Zambia. Yeah, that's where I'm at. I am also a part-time baker. Ooh. And I'm a part-time TV host on a show called The Teledoctor Show. That's on Diamond TV every Tuesday at 5:30 p.m. Yeah, that's what I do.
Wow, fantastic. Sounds like you're a busy lady.
I try. I try.
Oh, okay.
Yeah.
So today, like I mentioned earlier in the intro, we will be talking to you about fibroids. What are fibroids? How do they come about? What are the symptoms? What are the risk factors? What are the types? And if you have fibroids, what are your treatment options?
Exactly.
So that's what we'll be discussing. Tell us, Doc. When you hear the word fibroid, what comes to your mind?
Okay.
What do you say? You've met somebody in your clinic and you found a scan, and now you want to tell the patient what they have. What is a fibroid?
Okay, so a fibroid is simply a non-cancerous growth that occurs in the womb or the uterus, if you like. Like I said, non-cancerous. Some people actually believe that they can cause cancer, but there's been no evidence of them being cancerous growths. So they're just these growths that happen in the uterus. They originate from the smooth muscles of the uterus. And yeah, that's basically a fibroid.
Okay, so doctor, tell us what types of fibroids are there?
Okay.
Yes.
So
let's talk about types of fibroids.
Okay. So fibroids, the different types are based on their location.
Yes.
There are some that can be found outside of the uterus or the womb, if you like. There's some that can be found on the inside. And even that has implications on some of the different symptoms that a person can have, which we'll get into a little bit later. But just remember that the fibroids can be located anywhere inside or the outside of the uterus.
Okay, so you're telling us that fibroids can be inside, outside of the uterus, or maybe even in the muscle of the uterus itself.
Exactly. Right into the very meat of the uterus, if you like. Yeah.
So Dr. Namunji, now that we've talked about the types of fibroids that there is, let's very quickly discuss the causes of fibroids. What causes fibroids? Take it that I've come to your office. I'm a layman. I'm a client.
Okay.
I've brought you my scan, and it turns out that I've got fibroids. Can you explain to me, because I need closure? I want to know, why do I have fibroids?
Okay.
How is it that I have fibroids?
Yeah, innocent you. Like, where are these coming from?
Why me?
Okay. So there are certain people who are at high risk of developing fibroids. Okay.
Yes.
Number one, Black women or women who are of Black descent.
Yes.
Are at higher risk than our Caucasian or Asian friends. We actually sit at number one in terms of the races. So if you're a Black person, you're a Black woman, you are at risk of having fibroids. And then if you had your first period early on in life, we call it early menarche.
Early menarche. And we're talking about what, 10, 11?
Yeah.
Yes. So
some actually start as early as 8 years old these days.
Yes. So if you've had your periods, if you've had your first period at 8, 9, or even 10, or earlier than the average years, you are at risk, because what fibroids are, they're growths that thrive on estrogen.
Exactly.
They grow and thrive on estrogen. So if you have a longer period, say for example, you've had your period at 8, by 19, it will be no accident or coincidence if we came to a doctor's scan and found that you've got fibroids, because that's how it is. And also there's a link to hereditary. Like if in your family you have a few siblings, female siblings, even cousins, aunties who have fibroids, best believe that you're at risk of having fibroids in the nearest future. And some research has showed that certain foods that we eat, because you look back and say, in my family, in my mom's generations before, there were no fibroids. Why? Because the food that they were eating those days was not like we eat nowadays. For example, red meat has been linked to having producing fibroids in people, and these days we eat too much red meat.
Oh, we love
even fast foods, isn't it? Fast foods, this over processed foods rather, they've been linked to fibroids.
Exactly.
And other risk factors basically is if certain cancerogenics, like for example, hair products that we find in hair relaxers and hair products, like the benzyl parabens, the paraffins that we find.
So please read the labels on your hair products.
Yes, and that's another myth actually that we may not really want to debunk, but we actually kind of like confirming that indeed the research is there that certain fibroids, certain hair relaxers, certain hair products have been linked to causing fibroids because of the products that they contain, which are cancerogenic.
Exactly.
So, fibroids. Yeah, that's about the. Anything else that you would like to add on what is the risk factors of fibroids?
Okay, another risk factor is obesity. Obesity is a risk factor for a lot of conditions, including fibroids. So you'd want to keep your health in check, your weight for height, eat healthy, exercise. Exercise and healthy diet are like natural preventive medicine for a lot of conditions.
A lot of conditions, yes.
Yeah. And then, funny enough, smoking is protective. I'm not promoting smoking.
Okay.
Disclaimer. I'm not promoting smoking.
Be clear.
But let's just put out there that it is protective. It's been found to be protective, in case someone's wondering, because they came across a read of sorts.
Okay.
Yeah.
So one myth I want to debunk on the causes of fibroid is that I got a message where they said, "But doctor, I'm only 18. I'm only 17. How is it that I have fibroids?" So like fibroids are popular in reproductive age, and it goes back to what I said. Like if you attained your menarche early on in life, you have a longer period of exposure to estrogen.
Exactly.
In an instance where you already have this family history, and you start your menarche early, you have the risk, first of all, and secondly, you have this long period of your estrogen exposure. So you're prone to having fibroids even at 19. I've seen a case where this young girl, even at 19, she had fibroids and she needed answers from me, and I had to explain to her.
Exactly.
Like, listen, this and this, this and this, this and that. Let's get right into it. The symptoms.
Okay.
So to talk about symptoms, just to mention a few, so there's the prolonged menstruation, prolonged menstrual bleeding.
Yeah.
Normally a woman should have 5 days, others 6 days, but in this case it's usually 7 to 8 days, or even longer.
Yeah.
And you find that having even though it's a long period of bleeding, a long period of the menstruation, there's also an increased flow. There's also a high flow in the bleeding. Exactly. So you have the long days to menstruate, and then you have this high flow in the bleeding, and then there's also the pain, the spasmic pain that you get, the cramps, horrible cramps that to some people can be debilitating, that all they want to do is stay home, put a hot water bottle and sleep in bed for the rest of the day. And so like, what other symptoms are there that you would like to share with us on the channel today?
Okay, so some people might actually be surprised that some women don't even have symptoms at all. So imagine, like, you're walking around living your best life, and you have fibroids sitting in your uterus.
Wow.
So some don't cause symptoms at all, completely. But then it becomes a problem when they actually do cause symptoms. Maybe someone, like you said, you talked about heavy menstrual bleeding. Someone would show up with symptoms of anemia, they're aware of their racing heart, they're tired all the time. Sometimes you go up a flight of stairs that you normally go up, but this time around you get tired easily. So someone shows up with anemic symptoms, it turns out they have fibroids that are causing them to bleed more than they should. And also some people can have what we call pressure symptoms.
Yes, pressure symptoms.
Fibroids can go really big to the point where they start to cause symptoms like they can be sitting on your bladder and you find that you find yourself peeing all the time, or wanting to pee all the time. They can cause back pain.
Yes,
exactly.
And still on the bladder, some patients I've treated have come up with what is this urinary incontinence, where they say, doctor, every time after I use the toilet, after I urinate, sometimes I feel like urine is trickling down and I don't have control of that, and that is because the fibroid is pressing on the bladder and then causing you this urinary incontinence.
Yeah. And
you mentioned backache. Yes, backache. And what other pressure symptoms are they?
Other than backache, some people experience what we call easy satiety, like you feel full really easily.
Yes.
You've only eaten a little bit, but all of a sudden you feel full because it's putting pressure on your stomach.
Yes.
And in some women, Tombi, some of them actually have their periods go away for some time, what we call amenorrhea, and they think they're pregnant, but what's happened is fibroids are just sitting in your womb and they're growing big, and you can almost assume that, I'm probably pregnant, but
because then your belly starts to grow,
yeah,
right? Your belly will start to grow and you're I'm showing. You've missed your period, your belly's growing, and you're like, whoa, I'm pregnant. So there, make sure you go to the hospital every time your period disappears, and you could think you're pregnant, but it could be something else altogether. And also, just to add on the pressure symptoms, in an event where the fibroid is big and it's pressing on your rectum, you come with symptoms like constipation because you're not able to open your bowels freely.
Absolutely.
Because you have this mass. Imagine this mass is blocking the flow of your bowels.
Yeah.
What comes about is constipation.
Yeah. So
Another interesting symptom I want to bring up is infertility.
Oh yes.
Yes, infertility. So tell us about that.
Sensitive symptom.
Like how can fibroids bring about infertility? Let's discuss.
So like we said, these growths sit in the womb or the uterus, and that's where a baby grows. So if they're sitting in the womb, it becomes a hostile environment for a baby. Not that you can't fall pregnant, but it makes it a lot more difficult, especially if they're sitting by the fallopian tubes.
Right.
You know how, the sperm needs to meet with an egg, and then that's how fertilization takes place, and your baby implants in your womb and starts to grow.
Yes.
But if the fibroid is sitting near the entry of the tubes where the sperm is supposed to pass,
it's impossible.
Exactly.
Then it's impossible. And in most cases, if a fibroid is in that kind of position, this is the cases where you find a woman presents with ectopic pregnancy.
Exactly.
Because the fertilization, quite alright, has happened, but this embryo has had a challenge to come into the uterus, and in the uterus where it normally should implant, it ends up implanting in the fallopian tubes, and you have what is known as ectopic pregnancy.
Exactly.
Yeah. So all in all, fibroids are quite a challenge. Like the symptoms are a lot. There's something. There's quite something. So like women, this is what this video is all about. We want to educate you guys that if you have these symptoms, if you know somebody who has these symptoms, like let them be free. Like they should come and just have a routine checkup. It's a routine scan, because a lot of times fibroids are normally incidental findings. Somebody will say, I've got cramps on my period, it's normal. They take a Panadol and they feel better. No, that's not normal. Someone will say, my periods have taken longer this month. My periods, it's normal. No, it's not normal. Women, anytime you have long periods that last longer than they should, periods that are painful, that give you debilitating cramping pain, periods that have you bleeding out such that you get dehydrated, you even get dizzy and weak, that you can't do anything.
Or you use a diaper.
That you have to use a diaper. Then there's a problem. Then you need to get checked. Then you need to visit either one of us, and we will advise you what to do next, right? So I'm passionate about fibroids because to me, I feel like it's just a very interesting topic that, personally for me, I know at least one person who has it. That's why I always find it passionate. I always find it to be a passionate thing for me, that every year, every July, I want to sit with someone that we can chat about it and bring about this awareness, so that at least more people get to know about it. More people get to go and screen, so that more people are aware, and then they can start looking for treatment options.
Yeah, and get help.
Yes, and which leads me now, let's talk about treatment options.
Okay.
So, doctor, let's talk about, first of all, medical options, and then we can go to surgical options.
Okay.
So what medication are there that you can recommend to somebody to take?
Okay.
And when do you recommend medication? When do you recommend surgery? When do these treatment therapies come about?
into play?
Let's
Okay.
start with the medical therapies.
Okay, so with treatment, first of all, we only treat symptomatic fibroids, i.e. the ones that cause symptoms. If your fibroids are not troubling you, if they are not causing your quality of life to go down in any way, we leave them alone. There's many women who are living with tiny fibroids that are not doing anything. They're getting pregnant, they're having babies, they're not in pain, they're not experiencing any of the symptoms that we just talked about. Those we leave alone.
Yes.
Yeah, so we only treat the symptomatic ones.
Okay.
So if we have symptomatic fibroids, like you rightfully said, we have medical treatment and surgical treatment. The medical treatment aims mostly at shrinking them
Okay.
in preparation for surgery. But I need to debunk one myth whilst we're in the middle of treatment.
Yes. Let's go
Not
ahead.
all fibroids have to be removed. One of the myths I've come across commonly is, oh no, I have fibroids, I'm going under the knife. Not every person living with fibroids has to have them removed. Like we said, if they are not causing problems, we leave them alone. If they're causing problems, that's when we start getting to a place where we think we need to remove them. For example, someone who's trying to have a baby and there are these huge fibroids sitting in their uterus.
Yes.
It might be an option for us to remove them.
Yes.
So there's medications that are given in order to shrink them in preparation for surgery.
Surgery, okay.
I
okay.
won't really start naming drugs here because
Yes.
people like to get things over the counter.
Yeah,
Please
that's
don't
a
do that.
disclaimer. We're not going to do that.
Yeah, but visit your healthcare provider to discuss those things in detail.
Yeah, and just to add on, like treatments, like medical methods. So the medication that is available right now, what it does is it basically just deprives your body of estrogen, because these fibroids, these growths, they thrive on estrogen. They thrive
Exactly.
on estrogen. That is what they feed on to grow. And so the medication, the mechanism basically is that they block your system, your organism from producing estrogen, so that they can stop the fibroids, so that they can shrink. And if you're getting ready for surgery, they are ideal.
Yeah.
And if they are small but causing you problems, this is also another treatment method that you can consider. Okay.
Exactly.
Okay. So still on medical treatment, sometimes we want to treat the symptoms.
Yeah.
If a patient comes to me and say, "Doctor, I was found with fibroids, but they're not big, but I'm bleeding and now I'm feeling weak, I've lost blood, my HB, I checked, it's low. What
Yeah.
would you do for me?" In that, and then they say, "Oh, I also have pain on period." In that instance, I will put them on some painkillers.
Exactly.
I will also put them on some blood boosters, because I can't operate them just yet. They're small. However, they're giving them problems, and I can't not do something about it. In this
Exactly,
situation, I will put on blood boosters, I will put on painkillers, and I will say, let's put you on a surveillance. Maybe in the next year, we can do a scan. If they're big and they're causing you even more problems, we may consider surgery.
Exactly.
Moving on, let's talk about surgical
Options.
options.
Okay. So I want to debunk another myth as we talk about surgical options.
Let's do it.
I've come across a lot of people who say, I have fibroids. Does that mean I'm going to have my womb removed, or they'll have to remove my uterus? So that's an option for people who have no wishes of having more children or any children at all. But it's not our number one choice of treatment. Say, oh, you have fibroids, well,
Let's remove the uterus. Like we're not animals. We're not what do you call it? We're not sadists. We
No,
don't
we're
do
not.
that. You know, we're very considerate. If a woman
Exactly.
comes and let's say she's still in reproductive age, she has got this long fertility plan to have many babies, and she has big fibroids, we will try to do our best to
Exactly.
do what we call a myomectomy. So a myomectomy is basically where we go in and we take out the fibroids without removing the uterus, leaving the
Exactly.
uterus as it is, so that this client can go on to have many more children.
Exactly.
So one of the treatments is myomectomy. We've talked about it.
Yeah.
One other treatment that is there on the market right now, although not very popular in Lusaka in Zambia, is uterine artery embolization.
Exactly.
Basically just embolization, where they introduced a clot or an agent which blocks supply to these fibroids, so that they're
They die
starved,
out.
they shrink and they die on
Yeah.
their own, and the body takes care of the rest. So you have the myomectomy, and you also have this artery embolization. I mean, we have more because of technology now. We have this embolization which wasn't there before, and
Exactly.
it's actually a minimally invasive. You can go into your doctor, and they basically just make a small incision, and they access these areas, and you have a shorter period of recovery.
Exactly, and you're back at work.
Yes, and another myth that I've come across in my practice is that, doctor, if I have fibroids and I go in for a myomectomy, does it mean that my fibroids will never come again? No, they will come again. They might come again, because remember, these fibroids are they have their own risk factors. If you belong to the risk factors group, then for sure they will come again. They may come again, and so having a myomectomy is not a guarantee that your fibroids are gone for good.
Exactly.
Okay.
And still on the part of fibroids and them coming back, one of the myths I've come across is that if I have fibroids I can't get pregnant, or if I'm pregnant and I have fibroids I can't carry to full term. So let's debunk this myth.
Okay.
If you're pregnant and if you have fibroids, it doesn't mean that you can't carry to full term.
Okay.
It's a possibility for you to carry to full term. You just need to stick with your healthcare provider. Make sure your pregnancy is closely monitored. They give you tips and tricks on how to maintain your pregnancy to full term, and you can carry to full term. We've seen enough patients who've fallen pregnant and they have fibroids and they've delivered healthy babies. Okay, and then having fibroids doesn't absolutely say or mean that you can't get pregnant. Remember, the position of the fibroid matters.
Yes, the position matters. However, I do want to say that you can get pregnant with your fibroids.
Yeah.
However, it's a high-risk pregnancy.
Exactly.
Your general practitioner will tell you that you're a high-risk pregnancy. They'll schedule your antenatal visits maybe weekly to weekly, as opposed to monthly in the first trimester. And they will just keep a good surveillance on you.
So stick to your doctor.
Yes.
Be best friends.
So another myth that I've come across is that apparently fibroids are caused by witchcraft.
Oh, they're
Somebody has
spiritual
built
babies.
Spiritual attack. Spiritual attack. Like, guys, come on now. Like there's a myths, and people are out there believing them to be true. But I'm here to tell you that fibroids are not. They're not a witchcraft thing. It's nobody has bewitched you. Nobody wants you to die. Nobody wants you to have a witchcraft baby, to carry a baby for them. No, fibroids are just growths that come about because you have been exposed to estrogen. You've had a long exposure to estrogen, and so it's nothing to do with witchcraft.
You talked about questions. I received some during the week too,
Okay.
and I have them on my placard.
I'll be happy to share them. Let's share them.
So this question was from Musama. Hi, Musama.
Hi.
Are they mostly found in Black women? As evidence shows, they are mostly found in Black women, or rather, Black women are at higher risk of developing fibroids.
It's a genetic thing, guys. It's a genetic thing. It's an ethnicity thing. Yes. So
not that they can't be found in other races, but high risk Black women.
Yes. So by virtue of being Black, sweetheart, you're at risk.
Yeah. So think about that.
Yes.
Okay.
Let's go on.
Do they happen to women who don't have kids or have taken long to have kids? Okay, there is a saying. I'm sure you heard that saying in med school.
Yes. An idle uterus.
Yes.
Let's say it together. An idle uterus is a fibroids workshop.
You sound excited, but it's a very horrible thing.
It is. So what that basically means is that if you haven't had a baby before 30, before 35, the longer you wait to have a baby, the more at risk you are to having fibroids.
Exactly. So, but the funny thing is, it doesn't mean that because you've had kids, you can't get fibroids. Let me just put it this way. If you have a uterus and you are a Black woman, you are at risk.
And you're in a productive age.
Exactly. Though there are some older patients who actually have them. They do tend to shrink or almost disappear as we approach menopause because, estrogen's being cut off.
Yes.
But it doesn't mean they can't have them still. especially people on replacement therapy, hormone or replacement
Yes,
therapy.
hormone replacement therapy. Yes.
And then there's another one here which
okay.
says, are fibroids caused by hair relaxers? I think you
I touched up on that, so
one.
yes, I have addressed it, and I think
Exactly.
we can move on to the next now.
Yeah. There was another one which said, if you have fibroids, you have to have them removed surgically.
Doc, this myth, we're debunking it today, saying that surgery is not the only option for treatment of fibroids. Like we mentioned before, like we've talked about the medical treatments, and we've said that surgical treatment is the last resort.
Exactly.
It should be the last last of resorts, because it means that you've tried these others and then you failed, and then surgical is the last. And even after surgery, you can still get pregnant. You can still carry to full term. You can still have your babies be born healthy and enjoy a pregnancy. What we're saying is surgical treatment is offered to those who are very symptomatic, such that their quality of life has been debilitated. Those are the ones who benefit more from surgery.
Exactly.
And even when we do plan for surgery, if they are big, we take our clients through intense counseling, because we need to prepare them that should we encounter things in the operation, be prepared that we might just have to remove the whole womb.
Yeah.
But that's a topic for another day. Well, Doc, thank you so much. I want to say thank you so much for coming on the channel, and I'm sure my viewers have learned so much from you, and we do appreciate you. We hope to see you again on this channel for another interesting topic that we can just maybe next month, the other month, whatever comes on the public health calendar that we can discuss. Whatever awareness campaign that you'd like us to talk about, please be free to come back. It's been a pleasure. If you have any last words to say to my viewers, they will appreciate.
And thank you so much for having me. Last words. Know your body. Doc here mentioned about, prolonged periods or period pain and the like. It all stems from you knowing your body. Know how long is a long period for you. For some person, a normal period is 3 days. Then if she goes 5 days, it's abnormal for her.
Yes.
So it's important for you to know your body, know your period, know when it's extreme period pain, know when your lady parts are producing strange discharge or you're bleeding in between your periods, all of that. Know your body and get help from the clinic or hospital. Google's good, for reading, but go to the clinic.
Yes. Oh, thank you so much. If you're new to this channel, please do subscribe, like this video. Do leave me a comment if you know about any other myths that you'd like for us to debunk, or if you know any person in your community who has fibroids, share their story with us so that we can grow as a community. And I'll see you in the next video.
Bye.